Welcome. I'm Jessica Pelkey. I'm going to be your host for this webinar, Oral Hygiene Concerns and Options for the Different Gem States. I've divided this webinar into chapters based on the different gem states. So we will kick it off with what we should know about oral hygiene concerns.
Topic for today is dental care, mouth care, oral care for people who are living with dementia. And we're talking about from very first indicators that somebody is living with dementia until right before people die with dementia, and what should be, could be, would be better to be done around and for their mouth, which then means for them. So we'll also talk about what some of the common issues might be in each of those gem states. And if you're unfamiliar with that classification system, it's a way based on Allen levels of looking at people's abilities and what they're not able to do and matching up our support and our help and the changes in task and environment so that they're successful and engaged and we're getting done the things we feel most important to get done without totally distressing them or us. So there's a nice matchup. So when we're talking about people with dental care, it's particularly important to remember that you can either learn to dance with your partner, even though the dance they're doing isn't the one you would choose. You would really like to get all that debris in all those little places with a water pick and with floss and with all kinds of good stuff. Or you can work with them and do what they'll allow you to do without creating a negative emotional memory of you trying to do something. That means they have great power. If you would take your fingers and just take them along your cheeks and sort of grit your teeth just a little bit. And what I'm going to tell you, the muscle structure that closes jaws is a lot stronger than the muscle structure that opens them. You have to actively open your mouth up, except when you're sleeping, and then gravity drags the bottom lip down, the bottom jaw down. But essentially, most of the time when we're awake, when we're alert and awake, our mouths are closed and sealed so that we can control the saliva that comes out, because nobody wants to look all drooly. Now, small children, infants don't really care. And when they're teething, you know sort of how much of that happens. So toward the end of life, we might see a return to that kind of thing. But the tricky part for us is learning how to do this dance based on the person's abilities and tolerance and our desire and our skill versus simply tangle with people. And much like bathing, mouth care can create a lot of tension and distress in both partners. And when we start doing it to get it done and we start thinking that we can be the boss of somebody doing it, what ends up happening is we get refusals and resistance. And once that starts happening, we're building a wall between the two of us. So we may have to stop, back off, give it a rest, find a new partner, or try it over again. But the goal is learning how to dance. So being right about mouth care and about what people should and ought to do isn't necessarily going to result in a good outcome. You can be right. It would be great if she took her dentures out right now and let you soak them and let you make sure that she has rinsed and cleaned her mouth completely after that meal. But if she's adamant about getting up and going right that minute, figuring out how to work with her dance is more important than getting those dentures out right in that moment. More than likely, because what will happen is you'll make her so distressed with you that you're not going to be successful. Not just this time, but you're setting yourself up for problems in the future. So the critical thing to remember in mouth care, as basically almost all care in dementia, and relationship is the most important thing. It is not that outcome of whether or not you got those teeth clean that one time, but instead whether or not she still likes and trusts you. Because one of the most intimate things you can do is help somebody eat or drink, help somebody take care of their mouth, whether it's dentures or teeth or gums or lips, and do pericare. Those are, for most people, the three most intimate things we do: eat, drink, mouth care, and pericare. And yet we get very little preparation in how to maintain relationships and prepare someone for that changeover in who's doing what in those situations. So what we do know is that in dementia, there are patterns that emerge. And so people do keep some skills and abilities, and they lose some stuff. So the more we are tuned into what they have, what they keep, what they still are capable of, and what they're missing, that allows us to figure out how to fit with them, how to match up so that we end up with a better outcome. Now, under this great big umbrella we call dementia, we also need to pay attention to the reality that, yeeks, dementia has lots of faces. And each person who's living with dementia will be unique, but there are different kinds of dementia. All around, though, I will say that this area of the body is one of those really sensitive in just about every dementia that I'm aware of. And this area is also where routinely we have a huge amount of sensation and skill. And as that ability fades, my awareness and ability to recognize, I've got a little piece of something from breakfast right over there, and get my tongue to go over and my cheek to work, and the saliva, and the negative pressure system that I can create by closing openings to my mouth and throat and nares, so that there, I got it. Good. All right. And then I'm actually gonna either carefully remove it or swallow it down. And that could be any of those dementias. Might start to see issues with that. You might see episodes and then return to baseline, more with Lewy body than some of the others. But you could also see that for people who have MS and start to develop a dementia, because that can be episodic as well. So this great big umbrella of dementia, the reality is when it comes to mouth care or oral care, we end up having issues in similar ways, slightly different, in all dementias. It's sort of a universal issue. And part of it has to do with it's a very intimate space and it's a very intense task. And it's actually really complicated. So just to give you a sense of the complication, go ahead and imagine, I actually have mine, but imagine you're holding a toothbrush, and you could close your eyes if it's easier to do that. And what I want you to do is pay attention to how many shifts in wrist position and hand position you have to do in order to clean all the surfaces of all the teeth in your mouth. And I'll do it for you. You can watch me if you don't want to do it yourself. So I'll go through the motions. All right. So how many did you notice? Studies reveal it's somewhere between 32 and 42 different shifts and positions in your wrists, in the direction of the movement of the toothbrush, the bristles. That included my tongue surface and the upper part of my palate. So 36 to 42. If we keep in mind that working memory holds about 5 to 8 things at a time, what my brain is actually doing is chaining from one area to the next area, to the next area, to the next area, to the next area, to the next area. Keep in mind where I've been, where I haven't been, where I need to go more, and where I haven't touched, and when I'm finished. So it's actually fairly intense and complicated. Now, that didn't even count getting the toothbrush, finding the toothpaste, putting the toothpaste on the toothbrush, putting it under the water for many of us because we like it moist when we put it in our mouth. And then after I'm done with this, I have to swish, I have to spit, I have to turn the water on. It turns out this is a highly complex task with a lot of fine visual motor skill integration and a lot of sequencing going on, as well as hand, mouth, eye coordination. And how much to brush, which direction to brush. I'm actually having to reverse up, down, in, out. And so here's a question for you. So Corey, if you would pull up the first poll and let's see what people are thinking. Okay, so here's your question. At what gem state do we start seeing problems with mouth care? Where do you think we start seeing problems with mouth care? Oh, Corey, guess what? We're missing a gem state. And it's a real important gem state.
Why am I going blank right now?
Okay, what's the one that's hard, rigid, and inflexible?
Oh, diamond. Golly Moses. Sorry, y'all. Don't forget diamonds. If you think that it's diamond, type it in the chat box for us.
I'm testing your fine motor skill set and your visual motor integration. Or if you have another answer, that's cool too. There we go. All right, for those of you who picked diamond, you're absolutely right. It's underestimated how often diamonds are actually losing ability and that mouth care issues crop up way sooner than anybody thought they did. So by the time people are approaching emerald state, they have on average, hold up your index and your middle finger, 2 cavities and gingivitis. Because, why? So somebody want to give me a guess on why, given what I just talked about? How about Mary Kay Anna?
They don't realize that they're missing areas and they're forgetting how to get around in the mouth.
Okay, yeah. So what ends up happening, that's one reason, is that when they do mouth care, they're skipping some of the sequences and they didn't realize they're skipping sequences, or they're going back to previously used sequences, and those might very well not include a couple of things that they have picked up recently because of the gum issues of receding gums a little bit or problems. And so what they aren't doing anymore, they totally, oh, I didn't even talk about that one, did I? They're not flossing anymore. And so what happens is the newly acquired habit of flossing, because most people who are now in their 70s and 80s, flossing was a learned skill after mouth care. You did toothbrushing and how you do mouth care long before you learned about flossing. Flossing was not a childhood habit. Flossing was a thing you learned as a young adult or an adult, or maybe you told the dentist you did and the hygienist you did, but you didn't do it that often because it's just not one of those habits. And so now that you are a diamond, since it wasn't a really strong habit, you're back to previous things. And you might actually be skipping some of those sequences because one of the hallmarks of most dementias in the early stages is difficulty with going from complex sequence to complex sequence. And so what happens is one of those bits or pieces gets left off. The other thing that we start to notice with some people who are in diamond state is this pattern of brushing rather than this pattern of brushing. So this cleaning motion, that's an up-down motion, because when they first learned to brush, it was just basically clean the surfaces of your teeth off any which way you wanted to. There wasn't a lot of instruction with it. And so what happens is people do what they're doing a back and forth movement versus a rotational movement at the wrist, because it's actually a more complex movement than taking your arm and going back and forth with it. So what we find is that people are cleaning, not necessarily skipping whole steps, but inadequately cleaning. So yeah, it actually starts with diamonds. And Unfortunately, by the time we're starting to really notice there might be some issues, by that time we've got significant issues in the mouth. And by the time people are moving into facilities or institutions, estimates are 25% of those folks have active disease in their oral cavities. So they have cavities, they have root problems, they have issues with gingivitis. So they're actually really having problems with mouth, not just mouth care. So what I want to do now is head on back to the PowerPoint because we have more to talk about. So let me go back to sharing my screen here. And I want to just briefly, for people who are not as familiar with some of the things that happen with dementia, I'm going to take you through just a few of the areas that might have impact. So in this particular picture, I'm going to use my little cursor to help you see. This is the back of the brain where vision is located. This whole chunk, this middle section here, is your connection between your body and your brain. So it's called the sensory motor area. And then up front is your thinking brain, your prefrontal cortex, where you make choices and decisions and you initiate and sequence and finish something and move on. It's where you control impulses and you make choices that are good for you, not necessarily your favorite. And by the end of the disease, we have a brain that pretty much resembles this. And for Alzheimer's, this is the deal. But for other dementias, it's not abnormal to see a brain that looks very similar. In other words, we're down to 1/3 of the brain tissue. Now, of particular note with Alzheimer's and many dementias, the hippocampal area, this deep area, is shaped sort of like a seahorse, and that's why it's called hippocampus. This is the area of working memory, of the ability to learn new things and remember them, but it's also spatial orientation and temporal orientation. So you're remembering of time and space and place and situation. And whether or not you actually brushed your teeth today or whether you just classically brush your teeth, but maybe you didn't today because you were in a hurry or you got up in the middle of the night to go to the bathroom and you got your toothbrush out, but then the phone rang and you never finished. So that is what it should look like. And this is what it looks like by the end of the disease. Here is your ability to appreciate and to produce language that explains things and helps you appreciate when someone's giving you information. This is your left temporal lobe, where you find vocabulary, comprehension, speech production. And over here, you will see what they have left by the end of the disease on the left. This is their ability to hear sound, which is the interesting phenomena. It actually doesn't change significantly. However, the wiring across the middle does. And so it makes it hard for them to figure out where sound is coming from sometimes, or to know whether what you're doing is talking to them or talking to someone else, let alone that they don't get the words that you're using. This is a slice down through the center, like a slice of bread, only it's a slice of brain. And here we see the wiring that goes across the middle, but also connects your brain to your body. And these areas up here are the storage units, where you have a map of your body up there. And so your brain knows what your body's up to, and your body tells your brain your brain tells your body what to do when these areas are working. And this is wiring, and then we have storage. This is, again, the language center in that temporal lobe. And this is the rhythm and the music and the ability to use forbidden words and that kind of thing. And you can see the wiring across the center here. And these are the hearing areas. And what we have is, this is what's left. And so if this is what's left, that to some extent is going to explain why we're having so much trouble. But one of the things that we tend to forget is areas that had huge real estate when we started will now, by virtue of the missing pieces, become hypersensitive, hyper-focused, hyper-aroused, hyper. So in other words, things that wouldn't have bothered me before because I was taking in sensory all over the place now become areas of acute distress when you mess with them, because they're one of the few things that I can still do, but it may also mean that I spend a lot of time enjoying messing around my own mouth. But when you start to do something, we're talking about something totally different from my perspective. And without impulse control, oh, this is the prefrontal cortex that tells me, she's just trying to help you. Don't bite her. Don't spit at her. Don't knock the crap out of her. Don't pinch her. Don't scratch her. Don't take that toothbrush and bite down as hard as you can on it, because you could hurt your teeth. And truly, all she's trying to do is help you brush. None of that's working. So what I may or may not be really tuned into visually is not the art of mouth care, because we don't actually watch ourselves brush our teeth. That's not the issue. It's getting the stuff together to brush our teeth, knowing where it is, knowing what to do with it, which end do I use, what's what, where do I find it, and once I find a brush, is it the right kind of brush? It is my toothbrush or somebody else's. And those teeth, well, why would there be teeth out there? I've got them in I used to have them in my mouth back before I had dementia. That before I was older, I had my own teeth. They're still my teeth, but they're not in my mouth anymore. I could find them in all kinds of places. And if I've had dentures for a while, I'm not necessarily at some points in the disease real picky about whose dentures I have. I'm just looking for a pair of dentures. And when I see teeth, I put them in or take them out if I don't like the feel of them. So all of a sudden, mouth care takes on a whole new appeal, or lack of appeal. So what we're going to do now is really look at is what we're experiencing with mouth care, a problem behavior or a so what behavior. And I'm going to have folks just think on that for a second. So when you're trying to help somebody with dementia, what part of it is so what, and what part of it is really a problem? So do a little thinking there for a second. And if you want, use the chat, and if not, we'll pause here and I'll actually ask the question of the group. So what kind of things are true problems, true areas of risk and concern, and what are so what? What do we got? So I'll call on somebody here because I'll get the ball rolling. Hey, Jennifer, you guys there at Jennifer Fain's place. What are you guys thinking? What's one example of a risk, really riskier problem, and what's something that's just, so it's not how I would want it. You can't talk. You can just listen. I'm not sure I believe you, Jennifer, but I guess so.
Annie said bad breath and food on the face.
So whenever we eat, if I'm not getting this all cleared off around here, that's sort of so what? Or is it a problem? Which one did she say it was?
She said it is a so what.
A so what. And bad breath, a so what. Okay, anybody else have some so whats?
Someone commented and said cardiac implications.
So is that a so what or a problem or risk?
A risk.
Oh, it is a risk. Okay.
And then we've got the inability to chew due to decay as a risk.
Okay, as a risk. So because we're getting caries, because we're having root fractures, because we're having people not keep their dentures in, not using adhesive on their denture, then what we may say is, actually, that's sort of risky because now we have chunks of food in the mouth that may not get chewed, or how we're getting protein in may not get addressed if somebody isn't paying close attention and realizing, because they're not using their teeth to chew, they're not taking in as much protein. How are we substituting and finding an alternate protein source for it? Someone else I noticed put, but when you have bad breath, it's an indication possibly of halitosis and gingivitis are related. And so one of our challenges is it just bad breath, or has it progressed to gingivitis, or is the bad breath an indicator of a dry mouth, which is actually related to dehydration? And so the tissues of the mouth are not moisturized. And so when we put items in the mouth, like a toothbrush, or we try to put dentures in, the lining in the mouth, that oral cavity, is actually pretty fragile. And now what we've done is created no barrier between the blood and the bacteria in the mouth from the lack of oral hygiene. So now we have, when that cardiac risk situation was talked about, that's what we think some of those risk factors are, because when we open up, when there is blood, frank red blood in the mouth, whether it's caused by gingivitis or fragile tissues due to dry mouth, what can end up happening is all that bacteria along the gum line, all the bacteria from the food that wasn't cleared out or cleaned out, can in fact transfer itself into the bloodstream. And there's more and more evidence that this is real, and this is something to be concerned about. And some studies have shown that people are more at risk for cardiac events, but also just general health deterioration when we don't do adequate oral care. And the other problem is that when we're not doing regular oral care, there is a higher risk of aspiration pneumonia. And so folks didn't identify aspiration pneumonia, but it should be identified because all of us pretty much all the time are managing saliva. And saliva is that naturally produced fluid in your mouth whenever you're going to eat or digest, or just whenever you're around. If you're adequately hydrated, you're producing saliva. And you manage your saliva by swallowing it down. The act of swallowing saliva eliminates it, but it also causes you to clear and make sure that if you have any other secretions, you're passing them past the airway on the way down, so they're not hanging around and available, so that you end up with aspiration pneumonia. So good call, folks. And it turns out that there are very few things about mouth care that aren't actually potentially significant. The tricky part is where, when, and what. So food around the mouth, not necessarily a problem, other than if it causes us to have a reaction or a family member to have a reaction of trying to do something. Because if you start messing around the outside of my mouth, and I don't like that, there's an increased risk that I will stop letting you on the inside of my mouth because I don't even like you on the outside. So anything heading toward my mouth is a big pushback and no. So how we treat this, how we manage this, may very well either provoke me or support me in your care of my internal mouth. So let's take a look now and look at what is risky and what's going on here. So with the 6 pieces of the puzzle, we want to look at the person's personal history and preferences, the level or type of dementia they have, what other things they might have going on, health conditions or sensory losses that might impact care, environmental conditions, and then, of course, the care partner's approach and behaviors. And finally, what else has happened that day? What else has gone on before this or is going on after this? Or what am I eating? How much am I eating? How much of it is stuff that's good for me? And how much of it is stuff that I'm doing for comfort care? And how well am I eating, chewing, swallowing, and then clearing my mouth afterward? So there are these different scales that are out there. As many of you are very familiar with, if you've been around our block very often, we don't use the ones that are global deterioration or a 3-point scale. We use something based on Allen, but I've converted it and we have all these gems. So what I want to do now is talk a little bit about what are the dental care issues that we currently know about for people who are diamonds. They're still clear, they're still sharp, they're living independently frequently, they're still driving motor vehicles, they're still managing their lives. They're having some issues with independent living, perhaps not always exactly right, but they manage to get through a day and take care of business most times. What we know for those folks, these are the early issues. So if they are getting a new appliance, whether it's a bridge or a partial, or they're getting a new implant, or they have new dentures, or they have new, whatever it is, including simple things, just getting a new set of dentures that feel a little different, or having a new application process where what's happening is People are changing, things are changing, what's available is different. And it seems like it shouldn't be that hard, but if you have a new pattern you want me to follow, I will have high risk that I won't be successful. And they're actually doing lots of studies now in community populations to look and see what helps, what hurts, what makes a difference, what doesn't make a difference. So we can do this with your fingers. Everybody practice. Do this. Do this. Let go of things that don't really make that much of a difference, because we've got to focus in even early on some of the things that we want to establish as our pattern, so that as this disease moves forward, we have a handle on how to support people. So the things that are most noted to not get done: flossing and mouthwash, particularly if those are newer things that people just took on. One of the real challenges with mouthwash is, even in a diamond state, some people start swallowing mouthwash rather than swishing and spitting. Or because of the alcohol content in many mouthwashes, people find it burns, and so they quit doing it completely rather than looking for a mouthwash that doesn't have the alcohol content, because they like a certain mouthwash and it has lots of alcohol in it. And that also means, let me say, that if I have a care partner who is getting a little rigid and inflexible because they're really concerned about their person, guess where my dental care issues are? With the care partner. Because the care partner is getting adamant and firm, and it has to be this way, and you have to do it like this, and this is how I do, and so this is what we're going to do. And in fact, the evidence doesn't support a lot of behaviors. Really straight mouthwash, probably too strong for most people, especially as we're getting older. The alcohol actually dries the mouth out, and people are marginally dehydrated. The last thing we need to do is that. So cut it back. Put more water in, a lot less alcohol, and switch to one of the ones that Biotine, one of the ones that doesn't even have alcohol. But some people don't like the sensation, because it does have a different sensation in the mouth. And if you've never tried it, don't give it to someone else unless you're willing to try it yourself. Looking at long-handled flossing or big-handled flossing devices can make a difference, particularly if the person has arthritis in addition to other issues. But probably even more problematic for many people who are community dwelling is that they start missing dental appointments, dental cleaning appointments. They're just simply not doing the thing, or they never did do the thing that would have been great for their teeth. They may also have repeated questions or repeated problems, and it may actually, in many cases, dental offices may or may not be able to meet their needs. And ultimately, one of the biggest issues with diamonds is non-compliance, the way we would like them to comply.
Well, you finished chapter 1, and so far we've learned a lot. Oral care is actually one of the 3 most intimate care tasks. Eating and drinking, mouth care, and pericare are all incredibly intimate and sensitive. So, what else should we know about oral hygiene concerns? Well, Teepa actually says that even minimal oral care can stimulate the oral cavity, improve fine motor performance, reduce the risk of aspiration by about 75%, and decrease risks of pocketing food in the mouth. Now, we also learned that there are plenty of other risks and concerns. But looking at this from a care partner perspective, if we're being Sapphire, then we're really flexible and we're adapting for the person that we're working with, building our skill, knowing when to pause and try something different. We want to be dialed into visual abilities, language abilities, and what the person is feeling and doing, their skills. We want to use our skills to match up the just right support.
So I'm going to pause here and see if folks have some specific questions about what we should do when we're experiencing life with a diamond, someone who's like, well, I already brushed my teeth. I don't need to brush my teeth. I know how to brush my teeth. Why are you even asking me how to brush my teeth? This is bullshit. I don't know who you people think you are, but I don't need somebody. I'm not going to brush my teeth unless I get my toothpaste. And this is not my toothpaste. And you say, Mom, that is your toothpaste. It's a new outside on the toothpaste tube. I know it's the same toothpaste, but now it looks different. That is not my toothpaste. That is not the kind I like. I am not that. My teeth are sensitive, and I'm not using that kind because that's not the right kind. If you're not getting me the right kind, I'm not brushing my teeth like that. And you're saying, okay, Mom, let's go to the store. You come and see if you can find the one. I can't find it. That's why you're doing it. This is what pisses me off. You want me to do stuff and you're not even willing to get me the thing I've asked you to get. So let's just talk about some of the scenarios that are related to diamond. Because this is one of those ones, if we start having problems this early, we're going to really have problems later on. Listen, I don't understand why you think you need to get involved in my mouth care. I know how to do my mouth care. Do you think I'm an idiot?
No, not at all. I think you do know how to do your mouth care.
Well, then why are you asking me?
Well, I'm just making sure because, we have to go out later.
Making sure. You are not the boss of me.
No, I'm not the boss of you. You're right.
Well, then I don't see why you're getting involved in my mouth.
Well, I care about you, and I just want to make sure you look your best when you go out.
I always look my best. What did I do that didn't make you think I was going to look my best, you little whore?
That's not very nice, Mom.
Don't tell me I'm not very nice. You're the one that you're acting like I don't know what I'm doing.
If I had bad breath, would you tell me?
If you did, I would. Are you saying I have bad breath? Is that what you're saying now?
I think it might be a little stinky.
Well, you can forget this shit. We're not talking about this anymore. I do my mouth every day. I have brushed my teeth and use Listerine my whole life. How dare you?
Well,
don't well me. We're done. This is enough of this.
Okay.
Okay, so what happened, Jennifer?
I wasn't very convincing.
Well, you were trying really hard. Yeah, so there's a phrase that you might try, which is, I am so sorry, you're absolutely right. I had no right to say anything about it. And it's one of the most missed opportunities we have in the diamond state is when somebody calls us. Like if I were just to say to you, Jennifer, your teeth look like crap. You need to go brush your teeth. Would you be offended, or would you feel like I was really a nice person trying to help you out?
Well, I think I would second guess myself if someone's saying that, but I think my brain is developed enough to say, oh, that wasn't a very nice way to say it, but maybe I need to check myself.
Yeah, she probably wouldn't have brought it up if she didn't think it was an issue. I don't believe that she's doing this out of malice. I don't believe she would be ugly about that. I mean, she could have certainly done it in a different way, but I think, unfortunately, somehow I missed cues that she picked up on, and wow, how embarrassing.
Mm-hmm.
And you have that, what's called self-awareness.
Mm-hmm.
And yet one of the challenges with diamond state is all you have to do is raise my temperature the littlest bit, put a little bit of pressure on me. And what you might see is I start cutting you, and then it's all out of proportion. I'm actually not doing it in a reasonable fashion, and I'm missing all my cues. Or I get so embarrassed, it's like, well, you know what? I don't think I should go out anymore because now I'm a good judge of myself. And I certainly smell my breath. Just smell my breath. Can you smell my breath? I need you to check. Does it? And so now I'm hypersensitive and hyper aware. So what we want to be careful of is we don't bring it up in a way that's viewed as negative, because I might actually go back and start doing this. Over and over, and what I'm actually doing is wearing the enamel on. I'm being very aggressive. I won't stop it because I'm so afraid I'm making mistakes that I get overzealous with it. And I actually, right along the gum line, I don't have any enamel left on my teeth. I am cleaning my dentures so much. I'm not rinsing them very well though. And so now I'm getting leftover stuff in my mouth. I am using so much mouthwash that my gums are completely dehydrated, or I'm getting so aggressive, I'm tearing my gums up. And we could do either. I mean, I refuse to do it. And so I'm clenching my jaw a lot and refusing. And it all starts with how we bring it up in the first place. So, hey, Jennifer, look, can you see? Have you got a mirror here? Let me give you a hand mirror. There's a little something. You got something like right up over here. You know, here, I'll take this. Here you go. This is a little toothbrushy thing I found. You know, try it. See what you think of it. It's a little bit funky, but see and try it just like a little down motion like that. Here, give this a try, because it's you got just something a little bit. I don't even know what it is, but it looks like it's hung up right there.
Mm-hmm.
How did that feel?
That feels better. Like you're really trying to help me.
And so what I did is I focused on a little detail, and I focused on something that I actually know humans can't see into their own mouth when they're in a. And did I focus on the halitosis or the bad breath or the you're incompetent? You're not doing this. And so what I have to do is start to pick my opportunities in such a way as it's comfortable for you. And if I misstep, I've got to be willing to say, I am so sorry. I thought I noticed something. Maybe not. You know what? Here, tell you what, why don't you take a sip of water and just rinse and spit and see if that does it? Because what am I doing there? What did I just do with that one?
Now you're just trying to get her to cleanse her mouth.
Moisturize. So let's at least get some moisture in there, and let's move the moisture around a little bit, see what that does.
Could you offer her a piece of gum for the halitosis? Like, hey, I have a piece of gum here. Do you want one?
Yeah, try this, see what you think of it. So try this. Here, try this. This is a different flavor. This has some of that stuff that is supposed to be really good. So we're just coming up with ways. What are we really getting the person comfortable with?
Mouth care.
With whom being right there?
With the caregiver being there.
Oh, because most of us do not do mouth care in front of other people.
Right.
I'm pretty loose, but other than that, most human beings don't just go, okay, let me brush my teeth in front of you, and let me spit in front of you, and let me drool a little bit in front of you, and let me, that's not comfortable for most people. I mean, right. I'm sort of a whole different can of worms, but one of our challenges is just opening that door. We think about pericare being a very intimate task, and we would never leave the bathroom door open while we were helping somebody. But mouth care is a whole other story, and yet it's just as intimate for most of us because we're taking things that may be in there that we don't want anybody to notice and possibly putting it out there where people would notice. And we have habits in our bathroom with our mouth that, maybe we don't share too much. Okay. Somebody made a comment. Corey, could you remind me of what the comment was in the chat room?
Elizabeth, did Teepa start to say we are incapable of seeing inside our own mouths?
Pretty much. So there are surfaces in your mouth you can't really get an eyeball on. You can see the very front, and you can see some on the teeth and the tongue, but it's actually pretty difficult to view the inside surfaces of your upper set of teeth, unless you have you'd have to have two mirrors because you need that one there. That's why the hygienist does so much a better job than you can, because they can actually explore your mouth. It's hard to see inside your mouth. You can try to look in the mirror, but I guarantee you can't get all the surfaces. If you want to do it right now, just put your face up to the screen and just sort of check yourself out. Those buccal surfaces, they're sort of hard to get to. The very front, the inside of the front, those things up under your tongue. That's one of the reasons you might want to go to a dentist or a dental hygienist every now and then, because you can't actually see all that stuff, let alone keep track of what's actually going on there.
Jess here. How may we support early changes in oral care? Well, how are we having the conversation? We want to increase their comfort with us being with them through oral care. We can choose to focus on a detail rather than having them feel like we're pointing out an error or incompetence. We can show, and we can use the phrase, try this. We want to add to our tool belt the 5 I'm sorries. And overall, use objective evidence and supportive language versus pointing out mistakes. Thanks for sticking with us for Diamond. Next, we check out Emerald.
So what we're going to talk about next, I'm going to shift gears and talk about our emeralds. We can come back to this if folks want, but this area, people are actually starting to do research in here. And it has to do with getting a care partner early on, looking at the use of devices that are geared to helping a little bit. So I'm going to give you an example. A long-handled flosser is easier to use than a short-handled or just using the floss in and of itself. So people are starting to really look at options for early on and figuring out how to do that and when to do it. Now I'm going to talk about, however, emeralds. So emerald state is when I'm needing supervision. I have a hard time sometimes moving from step to step. I can skip whole tasks, or I can skip parts of tasks. I could do them over and over again. I can follow simple gestures and demo. And I do know where things are, but I don't always get it exactly right as to what to do when with what. I use my environmental cues, and I will look for things that I'm looking for, but I won't necessarily get all the pieces and parts. And I can become pretty upset if I can't figure out what I need to do or how to do it. So what we'll see at this point in the disease is I will have issues with missing my entire mouth care routine. I'll be incomplete in my mouth care. I am not tolerating appointments, so we may go, but I won't stay. I make things up about appointments and routines, and it's called confabulation. And it's not lying, and it's not deliberately making things up. My brain fills in the gaps and the holes with old or out of date data or just made up stuff. And my brain thinks it's true. I will refuse. I will come back after I've had an appointment to say I need an appointment, which is a little confusing when you're the deliver person of a care. And I get lost in getting to or coming from mouth care. So when we say an appointment, I'm talking about, possibly an appointment with a care partner or a person who provides intense dental care. But I would also tell you, I'm also getting lost just going to my own bathroom and finding all the bits and pieces that I need and getting it done. And I also lose appliances. I'm losing supplies. And I blame other people, but I often am hiding them from myself, and I don't realize that. So one of the things we want to think about is our positive physical approach. So Corey has a clip of somebody that we're going to take a peek at this point. And we're going to watch him do shaving first. And then we're going to take a look and see what happens after that. So we'll pause at the end of shaving. We'll see. Here we go.
There you go. You want to?
Plugged in.
It's already plugged in. I want you to get close to the mirror. Did you want to wet your face first?
No, for this kind of way.
You want to let it dry? Okay.
So I'm wanting you to watch Frank and notice his skill set.
Nothing beat a good razor.
It's real smooth.
Okay, he has actually been shaving himself for about 5 minutes. Just so you know. He's gone over and over and over. I'm just going to give you that piece because we cut to the chase here, but.
A little bit.
If you use a razor, you get it all.
Did you want me to help?
Nope.
You got it? All right.
Now, I'm going to pause there because I want us to talk about for just a second. Where did you never see Frank shave? Right around here. So he's going back and forth and under and back and forth and under, and he's done it multiple times. You can tell his language is a little less structured, a little less specific, and he's doing a nice job. He's very, very focused on the task. So given all that, Rachel, what are some things you're thinking you might be concerned about or interested in keeping an eye on when it comes to his mouth care, given what you saw there?
You have rubbing motion, breast rubbing motion.
Okay, so he has a higher risk of doing a back and forth over and over again rather than a selective wrist up and down, because you saw a lot of this in the shaving motion. Good. Anything else?
I think he's going to do the same parts.
He has risk for doing a repetitive part of his mouth and skipping other parts of his mouth completely. Anything else?
I think he's just going to get stuck and he's not going to know how to move on.
Okay, so he could get stuck and not know quite how to move on. So let's take a look and see what actually happens with Frank. So those are some good observations. So let's see how it actually pans out for Frank. Now, notice what's going on here. We have a helper. She actually handed him the toothbrush, and Frank stood there and waited. So she's putting on toothpaste. Now, I want you to take a look and see how much toothpaste she has actually put on that toothbrush.
Okay.
There you go.
Ready?
Ready.
Put that thing in the wrong place.
They did.
Okay, so pause here. So Rachel, good job. You were right on target with a few of those things. Anybody notice anything else?
Did he eat all that toothpaste?
Yep. And there was no swish and spit at the end. So whatever he has in it, whatever that toothpaste is, wherever it is, with all that fluoride, with everything on it, it's staying in there. And he's just going to keep on. And now he's going to go wash his face. And he never did a swish and spit.
He never seemed to go on the inside either.
Nope.
He just did very little on even on
He
the.
did the chewing, a little bit of the chewing surface and a little bit of the buccal surface, the outside surfaces, and that's it. He's done. Or he just does it over and over and over and over until the caregiver introduced to the washcloth. And when she brought the washcloth off, that's when he tapped the toothbrush and he's done. So what do you think some of the problems are going to be starting to crop up in this emerald state for this gentleman? What you thinking, Rachel? What are some high risk things that you're thinking about?
I'm thinking cavities.
He has a high risk for cavities, especially on the interior surfaces of his teeth. What else?
Well, eating toothpaste is not a good idea for one thing.
That's a lot of toothpaste.
That was like a whole toothbrush of toothpaste.
That was a load of toothpaste for not getting rid of it and not rinsing it out. Yeah. What about gingivitis? High risk, low risk, medium risk?
I'd say high.
Pretty high risk. Yeah. And he's just doing a back and forth motion. So what we're going to have is pretty high plaque buildup as well, because he's not doing any upward motions at all. And this back and forth, did it feel and look pretty aggressive?
It looked really slow to me. That's the part that I really picked up.
but one of the risks is he may actually be damaging his enamel. Okay, so what could we do differently? So what are some options that we should be looking at for somebody like Frank? What do you think? Hey, Frank, here, let me show you. Here you go. Try this. I know, this is weird, huh? Yeah, give it a try. Here, you try it. Yeah. Oh, look, over here. Do this side. You can do this side. And what you want to do, partnered mouth care. And it's one of the things caregivers never think about, truly. I go in there to get your mouth care done. I don't bring my own toothbrush. And I would do a lot better if I could bring a toothbrush in for myself and say, here, try this. Let's show you. Right there. You get it? Good. Because when I show you the motion, emeralds don't have that much trouble copying. And if I'm doing it, what I'm saying is it's okay for you to do it. Because here we are, 2 grown adults. And they want us to try something really weird. The hygienist wants us to try something. Tell you what, here, get your tin. There you go. That's it. Good. You got it. And so I can actually demonstrate the very motions, because it's not as though he doesn't have full range and full action in his hands. The problem is he doesn't have initiation and sequencing and the ability to come up with it on his own. So I can very specifically move him through the actions so that we're not getting him stuck and he's not skipping steps. But that also means I need all my equipment right on hand. I need the spit cup. I need the 2 sets of toothbrush. I need 2 spit cups, one for him and one for me. I need washcloths. I need things. So what I want to start doing is actually a little carrying case that I carry around. And the other thing is, because there actually could be a number of food particles, we should be replacing toothbrushes a lot more frequently. We also want to make sure they're completely cleaned after each one. And because I'm not sure for sure what all Frank might be doing with his toothbrush when I'm not around, we might also want to label these toothbrushes and actually take them with us, so we can keep up with people's toothbrushes and leave something there for them to have. It's not that we don't, but the real toothbrush, the one he's going to use, the one I want to make sure is actually the best quality toothbrush for him, I may want to take that with me.
Hi, Jess again. We've watched Frank, who is an emerald. So how do we guide oral care as more mistakes are being made? Well, with emeralds, they are making mistakes. They're needing supervision. They may be repeating. They have a tough time sequencing and may miss steps or the entire oral care routine. But they can follow gestures and demonstrations. They can copy you, and we can partner in mouth care. Show them only one step at a time. Break it down, and our emeralds will be fine. We hope. If we build our skills at how we're using our visual, verbal, and touch cueing to guide, then we can support our emeralds to shine.
My screen that I'm going to share will be about ambers. And you're about to see a very sweet lady named Norma and her husband, George. And Norma has entered the amber state. And she's in amber a good bit. She needs step-by-step. She doesn't follow language. She needs physical assist to do personal care. She can follow very simple demo and hand-under-hand guidance with a few repetitions. And she doesn't always use things very well. And she likes to handle or manipulate or touch things, but she doesn't understand tasks at all. And in her case, she doesn't get intrusive. She just gets inactive. So she doesn't go into other people's spaces or belongings. She just sort of sits. And she goes to places that are interesting, but very little interest in Norma anymore. And so she just hangs out a lot. And if it gets too crowded, too busy, she wants to escape. So with her, some of the things that we might notice care-wise is some hypersensitivity. and physically resistive to when people try to help. She's incomplete in the care. She doesn't do it. She has infections. She has had infections in her mouth, which has resulted in her ultimately at this point, by the time she got to Amber State, she's lost all her teeth. So she has an upper and a lower set of dentures because over time, she simply did not keep her teeth going, and George was not very quick to pick up on how severe it had gotten. So this was in a time, in a situation where people in North Carolina, it's not uncommon, let's just pull them all out and give her dentures. And this was about 17, 18 years ago, and that was a very common decision. When people had dementia and they were starting to get multiple problems with their teeth, it was not uncommon when they had limited teeth left. The decision was simply, well, let's just pull the rest out. It's just easier to go ahead and have her have dentures than trying to mess with it otherwise. Because partials were not considered the norm. It wasn't something that people thought that much about. People were very quick to just go ahead and get rid of the teeth because it would be easier to do with dentures. So that was pretty much the state of the art 20 years ago. That's not the case anymore, but for Norma, that's what happened. So she has a set of uppers and lowers, and she's had them for over 5 years now, and her dementia has progressed. And part of the progression is her dentures no longer quite fit well in her mouth. So what George does to compensate, because she's not due under Medicaid guidelines for a new set of dentures for 1 more year. So she's not due for them yet. And so what George does is he puts a really, really thick coat of adhesive on the uppers and the lowers. And so he leaves them in for 2 days, because when the end of the first day, they're still too firmly connected for Norma to be able to tolerate him getting them out, or for her to take them out. And so he waits the second day, and by then the adhesive is loosening up and he can typically get them out. So he has not done them the day before. So I will go ahead and show you my friend George and Norma. And George actually called me to come in because he was concerned. He thinks Norma has gotten incredibly stubborn and very frustrating, and she knows what I want her to do. And I've never seen her like this. She is choosing to stand up against me, and I am telling she is doing this on purpose. I mean, that's what he's telling me about the woman you're about to see. So this is Norma. We did a shower. We got her in her under things. And now George has realized, he just happened to think, oh, shoot, it's the day of the dentures. So.
Norma, I forgot one thing. We need to clean your teeth this morning. We didn't clean them yesterday morning. Get over here. What we'll do is take your teeth out and let them clean, and we'll go get dressed, okay? Stay right here. Take your teeth out, please. Norma, take your teeth out of your mouth. Norma? Yeah. We have to get your teeth out of your mouth because we didn't take them out yesterday. And I got to clean them for you. Yeah, see that? That was easy to come out. Now get your uppers out. Get your upper teeth out. Norma, get your upper teeth out. I can't get your teeth out. You have to take them out for me. Up there, that teeth. Take the upper teeth out. Take your upper teeth out. Norma, take your upper teeth out.
Well, that's all I can do is
Well, turn this way towards me. Turn towards me. Open your mouth.
Okay, I'm going to pause here for a second. Okay, now, what do you guys notice about George and Norma? Sarah, what did you notice about George?
Sorry, I'm trying to figure this out.
You got it.
Yeah, he's not really paying attention to her. He's so focused on the task.
Well,
And
is he happy with her?
no.
Why is he so mad at her?
Well, because she takes so long and she's not doing what he's asking her to do.
Well, but she did. See, she gets it. See how she took her bottom teeth out?
Uh-huh.
She knows what I want her to do, and she's not doing it, Sarah.
Yeah.
So why is she doing this crap? I mean, she used to be, well, I mean, what's going on here with her? And that's what I'm telling, she's getting stubborn.
Well, I guess she is.
So I'm going to replay this because I want you to watch how long it takes from George getting and saying this first phrase, take your teeth out, and doing the cue that she gets, how long it actually takes her to take the bottom teeth out. And then what George is doing and what Norma's watching George doing after she takes those out. So we're going to go back because I want people to realize really and truly, Norma is trying her very best to do whatever George wants her to do. George has not a clue that his behavior is what's making this impossible for Norma to do. And then at the end, I want you to notice where George's forcefulness is. Where is he showing a lot of strength and very limited skill? Because he too, in this moment, has turned into an Amber. He just is so focused on getting that upper set of dentures out of her mouth. He is using the skill he has, and he is really strong. And what he doesn't realize is what he's doing with his own mouth, right in front of her mouth. So this time when you watch, keep an eye on some of those issues right there, and watch his fingers on the back of her neck. Okay, so let's watch again and watch how much he talks and when Norma seems to get his message and how long it actually takes from the first time he says, take your dentures out. And let's see what happens.
Norma, I forgot one thing. We need to clean your teeth this morning. We didn't clean them yesterday morning. Come over here. What we'll do is take your teeth out and let them clean, and we'll go get dressed, okay? Stay right here. Take your teeth out, please. Norma, take your teeth out of your mouth.
That's where she got it.
Norma, we have to get your teeth out of your mouth because we didn't take them out yesterday.
13 seconds later, she finally moves her hand to her mouth from his cue of you need to take your teeth out. The only thing she was really picking up on was the visual cue of take your teeth out, and she took out, she did exactly what he showed her to do. That's the only thing she's getting from all this chatter and all this activity. Now watch what happens next.
And I got to clean them for you. Yeah, see that? That was easy to come out. Now get your uppers out. Get your upper teeth out.
No visual cue. No visual cue.
Norma, get your upper teeth out.
No visual cue.
I can't get your teeth out. You have to take them out for me. Up there, that teeth. Take the upper teeth out. Take your upper teeth out.
Now what he did there is he grabbed her hand and shoved it toward her face. And what did you notice? Yep, she flinched because she knows he's getting verbally, you can hear his rhythm and his intensity and his frequency. Is he happy with her? No, he's really getting angry. And Norma knows, she knows she's not doing what George wants her to do. So what you're going to hear now is her plea. And it's a plea. She gets, I'm not right. I know I'm not doing it right. So listen to what she says.
Norma, take your upper teeth out.
Well, that's all I can do is
Wow.
So her statement is, well, that's all I can do. And so George is interpreting her as being stubborn when she is just so lost in the moment. She so knows she's not meeting his expectations. She so knows she's wrong. She so knows she doesn't know what to do. And so this is where George goes from being an amber to being an emerald. And an emerald is next step. I'm going to get this step. And so he is going to get those upper dentures out. And so he becomes really focused. He's got binocular vision, task only. Those dentures have got to come out. That upper set have, and he's getting really strong and really fast. And it's almost like he varies between an emerald and a ruby, because he's going to try to use strength now to get this done.
Turn this.
So he
Turn this way towards me.
So he's turning her body, facing her. What we
Turn
know,
towards me.
confrontational.
Open your mouth.
And now, even though he's telling her to open her mouth, he's gritting his teeth and biting down as hard as he can. So what's the visual cue? Hold your dentures in your mouth. Clench down on it as hard as you can. So what's going to happen is George is actually encouraging her to bite down on the denture. And she only has the upper plate in. So what's going to happen is she's biting down, and it feels to George like she's what? Is she cooperating? I mean, she is actively holding these in her mouth. He's not looking in the mirror at himself. He's showing her to hold down on those teeth. And he's digging into the back of her neck. The next morning, she had bruises on the back of her neck, and he asked me where I thought they came from. Because what he had no idea is that he had bruised the back of her neck. Because he wasn't really aware of what he was doing with this hand, because he was so focused on what hand. Yeah.
You're making it hard for me. You have to take them out. I can't get them out. Get them out so we can clean them.
And then, to his frustration, really, he shoved her hand a couple times, and she finally gets the idea. He wants her to take those out. So she just immediately reaches up with both hands and takes the dentures out.
That's it. Come on, you got them. Good. Thank you.
So I'm going to pause there because, again, I'm not being ugly about George. I'm just, without skill building, can George do any better than what he's doing? And so what we have is a caregiver who's trying his very hardest. And George is an example of a family member, but there are just as many hands-on caregivers who are being paid to do service who are not trained in the skills of how to work with somebody who's in an amber state. And they're going to get something very similar. So what I'm going to do now is actually let you see what happened the next day. Because the next day, I took over Norma's care. And I want you to see the difference, okay, between our interactions. So here's what happens. It's the very next day. So do any of you think Norma's dementia has suddenly cleared and she's doing great and she's in a much better place dementia-wise? Like she has just watch her and see if you just think maybe, actually, maybe she doesn't even have dementia. Maybe it was just a delirium state or something. Let's give it a shot.
Not quite. Okay, let me give you a hand. Okay, let's do your upper teeth.
Teepa, can you pause
Open.
a moment?
It's going to come up.
I'm going to pull
there
down
you go.
on them. You ready?
Oh.
Okay, you pull. Pull down. There you go. Okay, take them out. Good. And put them in.
Okay, what's the speed with which she was able to do that? I said, okay. And all I'm doing, now remember, this is the very next day. So what does she have a lot of on her upper plate? The adhesive. So this is where George would usually skip a day, and I'm doing it the very next day. So there's a lot of adhesive on there. So we really did have to do a fair amount of tension down to get it to release.
Here.
Now,
right in here.
So I have to cure where to put them.
Okay. And now let's get your bottom teeth.
Hand under hand.
Yeah, there's a pieces of cereal.
She had pieces of cereal up under her dentures in her mouth.
Okay. Can you take your teeth out? Put them right in here.
Now watch this time what she does.
Good. Okay. Now, let's rinse your hands off. Rinse your fingers off. Good. Okay. And here's your mouthwash. Okay, you can spit right here in the sink. Good.
Now I want to pause there and I want you to compare those two. I mean, this is the same woman one day later. So I'm going to quit sharing and have you guys talk a little bit about what made the difference. So Corey, can you help guide anybody who might want to talk a little bit?
Did we decide, Deirdre, are you able to chat with us?
I don't mind talking.
I can chat a little bit.
Oh, whoever, Mary Kay too. Okay, and Lucy. Okay, go ahead. You guys get started. What did you notice about my friend Norma? What did you notice this time?
The visual cues helped her know what to do.
Yeah. So when I gave her simple visual cues and reduced the amount of language, Norma is able to do things. What else did you notice?
She accomplished a lot more steps of the task in much shorter time.
So it actually took less time to do the mouth care. And I actually was successful at the mouth care, and so was Norma.
Mm.
Oh, okay, cool. What else?
I would offer the thing, when he first came into the room, he had that thing where he had forgotten that they were going to have to do probably his least favorite task and that whole energy came in the room with him. Is like, oh shit, now we got to do your mouth care.
Exactly.
I think he reacted to that for the whole process of resistance, because she could feel he was not her happy husband.
Yeah.
And you came in and you just gave a neutral space for her. So that was what
Yeah, so you saw me holding the space for her, and she was actually, and I handed her that mouthwash cup. Now, you noticed I didn't, this was a while back. And so I didn't dilute it. I would now dilute it a lot. But back in the day, we just did standard of practice, and I just handed it to her, and she did it. How many of you were surprised at her behavior with that? What'd she do? She went to that next step and she spit in the sink. I thought for sure she was going to swallow it, but she didn't. I mean, and the really cool part is that second time once we got them loose, she actually went through the entire motion. She was able to copy the first time we did the upper plate and take it the second time and actually release the denture into that cup. So one of our challenges is helping people as they need it, not as we're comfortable. So I'm going to have you take a look at another clip because this is a combination, and it actually took George 2 weeks of respite before he had the energy to learn the skill of helping Norma and could let go of the idea that she wasn't doing it on purpose and that she wasn't doing it for me because she liked me better, and helped him realize the steps that we went through. And so there was a lot of training that had to go on.
Hi there, Jess again. We're on Amber. What needs to change when oral care seems like it's too much? Well, for our Ambers, they're hypersensitive in 4 areas: fingers, hands, the toes, the inside toes, the feet, genitalia, and our 4th area, lips, tongue, and mouth. Highly sensitive area. And our Ambers are very, very sensory driven. They have difficulty discerning the meaning of our verbal cueing. And they're having some object confusion. They even have difficulty recognizing their own needs. So, as care partners, we've really got to look in the mirror because we've got to figure out what visual cues are we giving? How much verbal are we giving? What's our tone, our expressions, and our grips? We want to increase our visuals and our demonstrations, and we want to use hand under hand to guide and to assist as possible. We want to use lots of proprioception and pumps to offset the discomfort of care. We want to provide stimulation other than this uncomfortable sensation of care. It's tough working with our Ambers. And George was an excellent illustration of somebody who's lovingly doing his best and yet really struggling. It can be tough to work with our Ambers because they've got enough skill to really be able to do some things, just not always what we want. So, looking in the mirror to figure out how can I shift what I'm doing to enhance the communication so that we can work together to figure this out.
So I'm going to go ahead and Corey, if we could watch Eddie, if you can get Eddie to share up. Because Eddie is the next point in the sequence. He is a Ruby. And I'll come back and we'll take a peek at Eddie a bit more.
Please. Scoot up to the sink. Stand up a little closer, Eddie. Perfect. Okay. Is that denture cream or is that fix it?
Okay. So I'm going to pause, if you would, for a second, Corey. So this is the aide who usually cares for Eddie. So what did you just notice? Or maybe you didn't. She doesn't actually know what he has in his cabinet. And what she just put on his toothbrush is denture cream, not toothpaste. So she put the adhesive on his toothbrush. So what might be causing that? Because this is important for us to try to be curious about, not judgmental. But she actually put denture cream, denture adhesive on his toothbrush to brush his teeth. So let's talk about 4 or 5 possibilities of what might be going on here. Corey,
is she his regular care partner?
She is. That is actually, she is his care partner. And she was one of the ones that asked me to take a look at him because she cannot get him to brush his teeth. He leaves the bathroom just as soon as she takes him in there. And she is not successful at mouth care with him. And he fights her if she tries to make him stay in there.
So I think I heard her ask the question, is this denture cream?
Yeah. So what might she not be able to do that nobody really recognizes and realizes?
Read?
She might not be able to read.
Yeah.
We make a lot of assumptions about people's reading skill sets. And we have created new systems that people use a lot of pictures when they're doing their checkoff and putting in their data. And in fact, some people are not capable of reading the details of what you find in a medicine cabinet. And if it's near the toothpaste and near the toothbrush, and it looks like it's coming out of a tube, just as people who are emeralds or ambers might do, they might make a mistake and put the wrong stuff on. So if Eddie has that happen a couple times, do you think Eddie's going to be really excited about mouth care, even if he was willing to do it in the first place? Yeah. The other thing that might happen is, and somebody indicated it down here, she might be anxious that I'm there. And so she's just not thinking. She just wants to get through this task. She's really curious about what I'm able to do that she's struggling to do. But at the same time, many people think I'm intense. I don't know. What's another word? I scare people. I don't know why. You know, I'm just there to help. But they view me as somebody who has judgment. And I'm just really trying to help. So what gave me the clue is it was pink and gooey. And I haven't seen much toothpaste that comes out pink and gooey. That was my visual cue that maybe that wasn't toothpaste. And she's checking it out. How did I get Eddie to move? Has anybody noticed anything about Eddie's bathroom setup? What's right close to the sink? That would be the exit. That's the door out. So if Eddie's back a little bit away from the sink, and he's not liking what we're doing, and he looks away from me, what's he going to see? How to get out of the room. And if I want Eddie really to stay there, what I wanted him is I wanted him up as close to the sink as I could get him so that he wasn't really aware that there was a way out. So go ahead, Corey, now and just play it forward a little bit, if you would.
Probably not what you want. I was thinking you
I know. I knew what you were thinking because I thought the same thing for a second when I saw that. We'll just use the toothbrush. It'll be all right. Here you go, Eddie. Brush those bottom teeth. Right here. Okay, pause. What did y'all see Eddie start to do? He's brushing over at his side of his face, maybe either going to a shaving motion or a combing his hair motion. Even though clearly it's a toothbrush, he really doesn't know how to use a toothbrush at all. And his hand motion is a gross hand motion. He's lost the ability to do a lot of fine dexterity with his fingers. And if you notice, his posture is sort of starting that forward lean business, which also might indicate some depth perception issues coming up, monocular vision rather than binocular vision. So let's see what happens when I actually, because he had the toothbrush, I'm using a little hand over hand, not hand under. I'm over top of his hand just a bit. So let's see what happens. Here. Those bottom teeth. There you go. Perfect. Let's get them a little bit more. You gonna take those out? Put them here in the sink. Okay, put them right there. Uh-oh, what's he have in the uppers that nobody had said a whole lot about? Is an old upper plate. So I lost my opportunity. Oh, man. If I had been just a bit quicker, I could have paused the button right in that moment, captured that upper plate, and gotten it cleaned up. But I didn't. So what do I have to do at this moment? I'm going to let that go because I really want to clean these lowers. Because what they said is they have a hard time with mouth care. What they didn't describe to me is his upper is a plate and the lowers are his real teeth. And so they have two sets of issues going on. They have a denture care issue and they have a mouth care issue. And what they weren't realizing is those are two very separate and different tasks. And what we want to do is separate them and work on one and then the other, not integrate them into one, which is what ended up happening here. So go ahead now, Corey. Here we go. Addie. Hey, Addie. I want you to brush your bottom teeth. Pause. So once he does his denture care, what's Eddie think? I'm done. So I've got to capture him. Now I'm getting a little, whoa, I wasn't expecting that. Okay, so now I'm having to revamp. So I'm doing a lot of cradling, deep pressure. I'm giving Eddie some deep pressure as I'm helping him come back over to the sink. Let's see whether or not it works. Here we go. Right here. On the bottom. That's it. Now, where is my hand now? There you go. Brush them real well. There you go. Spit in the sink. Here, spit right here. Let's get a little bit more. Okay, now, here, do the inside. Do inside. Turn this way. Turn. Turn.
Turn your feet. There you go. Turn, turn. That's it. Now, Addie, get a drink of water.
Oh, she might have already done.
All right, and sit. Perfect. You got it. Here you go. Wipe your mouth off. Wipe your mouth off. Okay, now let's.
Okay, so let's talk about Eddie for a second. What you thinking? He was a surprise in a couple ways, but so talk about Eddie. Was I completely successful? Do you think I actually cleaned all the surfaces of Eddie's teeth? No. No. Why not? Why did I have to let it go? Because at the end, it was like, okay, that's enough, Teepa. Leave it alone.
Because Eddie had to go.
Eddie was done. Eddie was finished. So Corey came across, someone met Corey somewhere, and she came across a new device. And I'm really excited about this device because I wasn't sure when she first showed it to me. And I'm going to show you here. I'm going to show it to you and what it looks like. And it's a toothbrush with some special design features. So what do you notice about it? And it wasn't designed for people living with dementia at all. So tell me what things you're thinking, just looking at it. Who has an idea?
You could brush the surface, the chewing surface, and get the sides at the same time.
Yeah, it's designed to remove plaque and to work on the gingivitis while it does the chewing surface with a motion like this and like that. And they actually, it's evidence-based, only with kids, not with people who are living with dementia. So we'll make sure that you get the citation for this article, but they demonstrated that it cleans plaque as well as if you were to go in and clean it yourself. But this way, I have participation from the person. They're actively doing some of the tasks with me. And with this one motion, back and forth, I don't need to do inside, outside, stroking down like this. Instead, it's this motion. And you can use it, and the term that it is, it's called a Colas curve toothbrush. Colas curve. And it comes in a variety of types. They have medium, soft, periodontal, baby, and junior, because it was originally designed for people, the children and young adults that have developmental disabilities. But it turns out, I actually think this might be something that could really make a difference as far as being helpful to reduce the disease of gingivitis for many of our folks in the ruby and the amber and even the pearl state, because this motion there's not as much having to get out in the upper and this outer edge and in this outer edge and in this outer edge. So suddenly what's happening is this motion allows me to get both sides of the teeth down at the gum line, the chewing surface, and then I've got 4, and then the front, inside and outside, and I can do some back and forth, but I can also have the person doing that, not me doing it to the person. So what do you think about this device? How many of you have seen it or heard about it, and how many it's a new idea? Yeah. So what do you think?
I am curious, have any of you seen it before? And if you have, give us a thumbs up or add something to the chat comments, because this was just sent to us recently.
And I've actually tried it on my own teeth, multiple ones, because we got several. So this is sort of on the front lines, trying to figure out what helps. And what we're talking about here is not just a technique, but a tool, a device that might make a difference. So this is where we have the opportunity to move this forward. So by the end of this, I will actually have Corey send out the information on this device and this tool and where it comes from and how you can get hold of it. And we'll also make sure it's in the next journal article as well. But for me, for people who really like to be in charge of their own mouth care, they're going to be a much more effective mouth caregiver than any of the current devices that are out there. And there's also a big difference between that and the vibrating toothbrush, or the one that moves around in your mouth. If you have never in your life used a move around in your mouth toothbrush and somebody gives you a move around in your mouth toothbrush, some people are very accepting of new things, and some people are, the hell was that? Get it out. You're not doing that. Get it out. And unfortunately, because they're not familiar with something moving in their mouth, their brain went, that doesn't feel safe. I don't like that. I'm not doing that. So we wanted you to sort of take a look at, yes, I can get there and I can help my friend Eddie get some mouth care done. It's still inadequate. However, it's a little concerning that our hands-on caregiver may or may not be routinely getting in there at all. And if I have a way that I can help Eddie, and then we can actually be more effective, super cool. Super cool. And that's a Ruby state. So the last person we're going to take a peek at in the last few minutes is, oh good, Lucy had a good idea. Do we need to do Eddie's mouth care in the bathroom? No, I don't know that we do. That's a really great idea, Lucy, because mouth care can actually take place anywhere. And if the bathroom is a tricky place, why else might it be a tricky place? Remember that other intimate care we've talked about? Peri-care? Yeah, if I already don't like it because people attack me in there for that, getting out fast is my strategy, and staying around the sink doesn't sound like a good plan. So yeah, doing mouth care elsewhere, that's a great idea, because there's no magic about that sink. It's just convenient. And I get mouth care done a whole lot better in people's rooms without a battle. So that's a great idea.
Jess here. Rubies. What might we try for limited and gross motor abilities? So, in terms of our oral hygiene concerns and care options with Rubies, for them, we're looking at a lack of depth perception, which we saw with Eddie when he wasn't sure what to do with the toothbrush, where to put it. He could have been thinking it was something else. But the fine motor abilities and the abilities to manipulate the tool, those aren't really happening for our Rubies anymore. They also have very little comprehension of speech, and they're down to monocular vision. Yet they still have gross motor abilities. They can copy, and they definitely understand our expression and our tone. Intonation matters. So we can use hand underhand to guide our Rubies. And we can be that fine motor. We can use deep pressure to offset the discomfort of the sensation. And in the video, Teepa mentioned she used hand over hand. Let's take a look. This is a shot from the video. Notice where Teepa is gripping. She's actually gripping the toothbrush. And then her hand comes around his hand. Now, try this yourself. If you have a pen or something like a toothbrush to hold, go ahead and hold it in one hand. Otherwise, just make as if you're holding something and take your other hand and just grip over top of it and squeeze a little bit. Notice how that feels. Comfortable or uncomfortable? Do you like it? Would you want to keep that hand gripped over your hand? Now shift to gripping the toothbrush and or just use your fingers to guide a little bit of movement without any gripping. How's that? It actually triggers a reflex when we get gripped on the back of our hands. It's a release. We don't like it. Whereas hand under hand is more supportive, and we can guide the skill and the movement without feeling restrictive. So there you have it. Hand over hand versus hand under hand. Although hand over hand can come in quite handy as long as we're not being restrictive. So that was our Ruby care skills. Ooh, we also considered, is the bathroom really the best place for care? It may be the most convenient, but is it the most supportive for our Ruby? And we looked at the Collis curved bristle toothbrush as a possible adaptive tool. So that might be a really cool option as well. Thanks for joining for Ruby Oral Care. Pearl's next.
So the last one I want to show you is Edna, and that's in PAC Skills Make the Difference, or Positive Approach to Care Skills Make a Difference. And what you're going to be really hopefully paying a careful attention to, Edna does not like mouth care. It's intense. Edna's in a pearl state where she really doesn't have a lot of abilities. She is not able to use her arms. She's not able to use her mouth very effectively. She has gross head movements, but she has a lot of reflexes. She also has a history of having multiple teeth with lots of cavities, and she actually had a root fracture, and they had to take a tooth out because she had a root fracture off, and it was not a good experience, and that was prior to this. So Edna is really struggling around mouth care. Let's take a look and see how it goes, though, because I'm gonna do my best with Edna.
And movement will become difficult as well. Care partners will want to learn the art of letting go rather than simply giving up. This next video clip, I'm working with Edna, who's a pearl. She has very little movement, very little ability. And yet, with the use of the techniques we've talked about, I'm able to help her brush her teeth. Watch what happens.
Hey, Teepa, can you mute while we're playing the video?
That's what I was going to do.
Okay. Sounds like somebody's driving by with a trash cart or something. Thank
They're
you.
just taking people to their car.
Happens when I switch to her dominant side. Mirrors are tricky. Pay attention. I don't actually video clip. I'm working with Edna, who's a pearl. She has very little movement, very little ability. And yet, with the use of the techniques we've talked about, I'm able to help her brush her teeth. Watch what happens when I switch to her dominant side. Mirrors are tricky. Pay attention. I don't actually move but one time.
This side. We're going to start with this side. And I know it's not the most comfortable thing, is it? Let me go to the other side and see if that works better. Let's try the other side. Okay, we're going to try over here. Here we go.
Now,
That's
what
rough.
you saw there was a grasp reflex.
I know.
So she was grabbing my hand and wasn't letting go. So I had to pause what I was doing and get her to release my hand because she had me in a tight grip. So when I got my hand in there, she grasped. And a grasp reflex can happen for sure in a pearl state. We can see it sometimes in a ruby. If something strokes across the palm, it's a grab. So she was doing some grabbing. So on this side, what you're going to notice in a second is how I have my forearm, my elbow pressed against her body, so that although I'm not using a traditional hand under hand, I am connected to her. So we'll
Here you go. I know. Edna, let's brush your teeth. Here you go. Got it? Open. Ah. Open. That's it. You got it. Yeah. Perfect. Yeah. Good job. You're doing good. Let's do this side. Yeah, that's a lot, isn't it? Here we go. Nice work. There you go.
pause, Corey.
Okay, let's get this side.
So what can you do? Okay, so what you saw there was hard, reflexive. She's having to work really hard to get her jaw muscles to relax. She is working as hard, and as she's working, her head is moving because she doesn't have isolated muscle control. So then when she gets to a place where she's getting it, that's when she opens her mouth. So the pressure on the shoulder, the connection at the elbow. So keep going.
Nice job, Edna. That's a lot, isn't it? Let me get a little bit more moisture.
Okay, pause. So the reason I went to get more moisture is Edna is also a mouth breather. She doesn't breathe through her nose as much as she breathes through her mouth when she's at rest. And what that means is the passage of air in and out with the decreased fluid intake. What ends up happening is she gets a very dry mouth. And so when we go to clean things in there, we want to be very careful that we keep moisture going because she's not getting saliva production the way she should. Edna is very late in the disease. She has some paralysis, but she also has a lot of really intense reflexes. This motion, this arching motion, is an asymmetric tonic neck, but we also see an extension pattern that when she goes to open her mouth, instead of opening her mouth, her whole head goes back. Now, if you don't know reflexes and you're not used to neurological deficits like strokes or cerebral palsy, what you might misperceive is that she's resistive. Resistance is when she's just biting down and turning back and forth, and that's not what she was doing. There was eye contact there. Edna wants to work with me. She's just having to fight her own body to get her brain to tell her body how to do it and what to do. So let's see what happens when I go back for that with the moisture, because it's really the rubbing back and forth, not the toothpaste, and the water in the rubbing that's actually going to help with hygiene.
Here you go. Open.
Here she goes.
There you go. Nicely done. Nicely done. That's it. Nicely done. Nicely done.
Kind of amazing, huh? A lady who initially looks like she's going to actively resist and not allow this starts to participate, actually seems to get some enjoyment out of it, and is actively working with me. Now, mirrors are a little tricky. It may look like I switch sides several times. I don't. I simply get to her dominant side and use that to help her help me. Wow, cool.
Okay, Corey, can you pause us? All right, so if you haven't ever seen this video, this is one from Pack Skills Make the Difference. This is an example to show someone who truly thinks people at the end state of dementia can't collaborate and work with you. That's not true. Edna did. It wasn't that she didn't want her mouth care done, and it wasn't that she was resistant. It can look like resistance if you don't really tune in to Edna. Her eye contact, her looking at herself in the mirror, her participating actively, it was all there. And so anybody who says somebody at the late stages of dementia isn't there anymore, I think they missed the boat. Even in mouth care, when we do it the way that makes people less uncomfortable, nobody's enjoying it. It's not Edna's going, oh boy, this is fantastic. But she is going, well, that feels better than what it was. I like this better. And for Edna, it's not so much about just mouth care. It's about reducing her risk for aspiration pneumonia. But more importantly, it's also about relationships. Because in that moment, Edna and I had a moment together that otherwise she doesn't get to have. And she's in control. And I acknowledge what a great job she did. So today was about mouth care, oral care. Hopefully we gave you some new thoughts, some new ideas, maybe got you to think outside the box a little bit, maybe introduced a new piece of equipment, or got you to think about some of the people that are causing you a little challenge and realize it's not them, it's the dementia and how we're going about doing the support. So thanks everybody for being here. And I surely hope you're walking away with something you didn't have when you came in the door. I appreciate everybody's time, effort, and energy being here. I apologize for the background noise, but thank you for coming and being part of the team.
Hi, Jessica here. You've made it to the end. We've watched Teepa with Edna. So for Pearls, how can we provide oral care when reflexes rule? Reflexes have pretty much taken over the body. Contractures and stiffness have set in. There's quite a lack of comprehension, muscle control, very limited visual regard. And Pearls are also unable to move by themselves, unable to reposition themselves. So as care partners, we want to be thinking about providing moisture, providing visual, verbal, and touch cueing, and pausing to wait. How long did it take Edna to recognize Edna with the toothbrush on her lip? It was a number of seconds, but she did get there. And so she was able to participate in her oral care and do with, as opposed to Teepa doing to her and for her. We want to be thinking about supporting the neck and using proprioception on joints still to offset sensation and provide extra sensation when things are getting particularly uncomfortable. So it may seem as though Pearls and some of these other gem states are resisting, but they're really doing the best they can with what they have. And when it's challenging, Teepa said, remember, it's the dementia, and it's how we're going about giving the support. With the right support and the right care, all gems can shine. Thanks for being a part of this webinar, Oral Hygiene Concerns and Options for Care for our different gem states. Wishing you the best of luck as you try out some new skills you may have picked up from this webinar. Thanks again. Take care.